Here at the Financial Health Network, we care a lot about consumer financial health, and we know you do too. We're thrilled to see so many financial institutions advertising their commitment to financial health on their websites, on billboards, and in their mobile apps. In fact, so many financial institutions make these commitments that it's no longer a differentiator for consumers. So how can you show, in addition to say, your commitment to improving consumer financial health? How can you understand the unique financial needs of your customer base and design programs and services to address those needs? Finally, how can you understand the long-term impact of your programs and services on your customers' financial health? Over the past 15 years, we've worked with hundreds of organizations on these questions and more, and we know that the tools for addressing these questions are slow and unwieldy. My name is Bandyopadhyay, and I'm the head of product at the Financial Health Network. I was brought on to address exactly these shortcomings. I personally know this pain. Before I joined the Financial Health Network, I was head of science at Even, a company on a mission to end the paycheck-to-paycheck cycle. As head of science, I managed a team of data scientists and user researchers with a mandate to learn what actually works to improve financial health and then implement it and make sure that we were tracking our impact over time. I saw firsthand the difficulty of survey distribution and of connecting survey data with transaction data and other in-app product metrics. Before Even, I was one of the first hires at Varo Money, the first ever fintech to get a national bank charter. As one of the first hires, we were on a mission to build a new kind of bank with consumer financial health in the DNA from day one. I learned all about using our own transaction data integrated with data from external accounts via PFM and with surveys. And I saw how slow and frustrating it was to pool all of those data sources together to answer a very simple question. What do our customers most need, and how can we best help them? I was excited to come to the Financial Health Network because it allowed me to do this work on figuring out what customers most need and what we as financial institutions should do about it on a broader scale. I'm now building software to make the diagnosis and rollout of programs and then impact assessment of those programs much, much easier in a way that can be used by hundreds of financial institutions rather than just the particular one that I was working at. I'm really excited to show you what we've been busy building over the last year. This is just a sneak peek, and it's just the beginning, but I hope you'll enjoy it. How do you know what your customer base actually needs? Well, the first thing is to ask them. And we've made that quite a bit easier. Go to Add, give your quiz a name, choose your brand color, choose who you'd like to survey, add any optional questions. The demographics will benchmark to the U.S. Financial Health Pulse. The open-ended question allows you to hear from your customers in their own words. And then NPS and CSAT let you look at customer loyalty and satisfaction alongside financial health. And finally, email name zip lets you follow up with people one-on-one if you're using a public web link rather than emailing people. In this case, I'm emailing people. I'm going to have it go out on a Monday morning at 10 and end pretty late on a Friday night. And then have reminders go out 2 days after the survey starts to folks who haven't responded yet. And then at the end of the survey, I'm going to direct them to the Financial Health Network website. In under 60 seconds, that financial health scoring quiz is set up and ready to go, and will be emailed out on October 19th. Now, the dashboard is where it starts to get really fun. Let's say you've emailed your customers, you've asked them what they need, now you're going to see your results. At a glance, you can see what proportion are vulnerable, coping, and healthy. You can look at the financial health score broken down by spending, saving, borrowing, and planning, and look at each indicator as compared to the US average. And then in this interactive panel down here, you can look at overall health, or do a deeper dive into each of the 8 indicators, either in terms of vulnerable, coping, and healthy, or in terms of how the survey question was worded. You can also filter by age, education, income, and region. Your financial institution's results are in color, and the US Financial Health Pulse results are in gray. Finally, you never have to take screenshots again because all of these are downloadable. So that's all well and good in terms of the measurement, but what do you actually do with this? Well, the first thing to look at is the shape of the distribution. The second thing to look at is what are people struggling with the most, and what might you do to help with that particular indicator? In this dashboard, for example, the lowest scores have sufficient long-term savings. Finally, if there are any particular populations you're trying to serve, it might be good to narrow down here and look at what their particular financial health needs are. This is just a preview, and it's just the beginning, but I'm so excited to share what we're working on with you, and to share a little bit about how some of our early customers are using this. Some of them are using it for prospecting. They're embedding financial health quiz links on their websites so that they can learn what website visitors need and then talk to them about how the institution could help them with their financial health goals if they became members or customers. Other early customers of ours are using this to establish a baseline to understand where their customers are now in terms of financial health and what they might be able to do to help based on those particular needs. I'm really excited to be working with early customers who are so committed to our vision of helping organizations optimize for financial health in every single business decision. We still have room for a few more early customers if you'd like to help in the early days.